Ladies and gentlemen, boys and girls, welcome to the show. We have great guests today. Rene Margaret Field. And I keep wanting to say Rene Mulligan because we went to college together like 3 years ago.
Yeah, it feels so recent.
19 and a half years ago, we graduated from Notre Dame, Rene. 19 and a half. Holy old and old denial because I don't feel old. But you're here because you have been a contact tracer during this pandemic. For how long? How long have you done this now? Months.
Yes, actually, it's been 6 months. I started in July, and I was one of the first, like, 15 to 18 people starting at my health department.
This is going to be great. I have so many questions for you. What is contact tracing and why did you want to get into it? And then, like, what have you learned and seen? So and then, like, do you think people are bad people? That's kind of one of the ultimate questions we want to know from this is like, are people really, or do they just not understand? Or is there
Right.
a lot of ignorance out there? What is your experience with the common American with this? So a lot of questions. Why don't you start with what is contact tracing and why did you want to get into this?
Okay, it'll be interesting to see since you are the ER doctor at the other end, like a few days after the contact tracing is supposed to happen, if
Yeah.
you feel better or worse after this conversation when I tell you how it's going. But I was always in education, and when the pandemic hit, I was actually very excited about to start being a teacher aide, and suddenly schools were shut down and everything was closed, and I just felt like hopeless and useless. I really didn't like hearing that
Mm,
the best thing I could do during this crisis was to stay home. So
mm-hmm.
I started to pay attention to contact tracing. Now, the news would always mention that the virus could be controlled by contact tracing, and I talked to
Yeah.
lots of friends, and a Notre Dame friend even sent me a link to a course. So that's when I really learned about what it is. And so what it is the idea that if we can get to the people who have a virus, a communicable disease that's spreading rapidly, if we can get to the people who have it and get them to isolate and ask them who they may have exposed, then we can get to the people who've been exposed and warn them to quarantine, warn them not to go to work, warn them to stay home or be careful around their family. And that can reduce the virus. So it's very low tech. And every health department, actually, in America, had already been doing some contact tracing for other communicable diseases, but pretty much they all ramped it up to try to face what we were facing with COVID.
Yeah.
That's what it is in a nutshell.
And it sounds like you have 3 kids?
I
3?
do. Mm-hmm.
You have 3 kids. You were going back to teaching.
Yes.
And in the beginning of this pandemic, you wanted to help. You wanted to pitch in and help. And this was a way that you took a 2-week Johns Hopkins free course, became a contact tracer, and contributed, right? Tell me more about that. What I think so many people probably felt like you did, but not everybody did something about it. Why were you inspired to do something about it?
I mean, everything is timing in life, right? So it just was the right time. It was the right time for me to work outside the house. My kids were the right age, and so on and so forth. So I was
How old
really
are your
excited.
kids?
They're 9, 11, and 13.
Okay, good.
It had been the
Growing
right
up,
time.
huh? Yeah, they're not
Yeah,
littles.
took
Not
me a
littles anymore,
couple
Mom.
of years to get started. But I mean,
Yeah.
I think I was inspired by a lot of people. It took me a little while. I mean, I didn't start contact tracing until July, but you started to see people who were pivoting, who were, going to do one thing and then they ended up doing another. So I still think that there's lots of ways to help in the pandemic and, ways to shift what you might have been doing already. But contact tracing also fit really nicely with what I'm studying because I'm in school for school counseling. I myself am a grad student. So contact tracing
In
involves
like a master's of social work or what kind of
masters of school counseling.
okay,
Yes,
cool.
yes. So school counseling, you have to learn a lot about confidentiality, also in contact tracing, because
Mm,
you don't interview somebody who's 17. That's they are still a minor, but you would interview somebody
mm,
who's 18, or you don't talk to one adult about another adult's test results in the house. That
yeah,
is a breach of confidentiality. So
of
um,
course.
those relatable.
Even though, which is a little bit of a dilemma, right? Because the other one is potentially exposed and at risk and probably has some,
Mhm.
right, might be a strong thing, but they have some at least moral reason to hear about those things. Yeah.
Right. And the other similarity was that you're on the phone with people who are sick or upset, who've been stressed out for days as they thought, first you go through, is this enough? Am I sick enough to get a test? Should I get a test? And then what are my results? When am I going to get my results? What's going to turn out? And then they get the positive results, so you have to be a good listener too. And that, of
Hmm.
course, relates to counseling. So you just try to be empathetic and respond to what they're saying. So
What do you say when people, what are some of the common, more extreme emotions that people experience when you call them and tell them they're COVID and talk about this?
I mean, sometimes people cry. Um, somebody has said, "I ruined Christmas."
Mm-hmm.
It's sad. It's stressful. Um, there, it, even if the health outcomes are okay, COVID still can cause a lot of financial destruction, a lot of
Mm-hmm.
emotional distress, and
Mm-hmm.
that it doesn't have to mean you end up in the hospital. You can still have a very profound and exhausting experience with COVID just because of the emotional or the financial toll. So
That's a good point. What do you say to, how do you comfort people on the phone? Let's say I'm somebody and I'm like, oh my God, I'm exposed. I'm gonna kill my grandma because I got COVID. Oh my God. What would you say to that?
yeah, I'm glad you asked because I think some people are afraid that contact tracers are like calling to blame and shame, but that is not what contact tracing is for. So if someone is crying like you, I would say, it's okay. You didn't know you had it. You were pre-symptomatic. It's very hard to tell. I say that to people a lot because people will often go around for 4 or 5 days thinking their symptoms are probably just a cold or whatever they experience at this time
Hmm.
of year, and then they feel terribly guilty. And I'll say it's okay. It's very hard to tell. You didn't know, but now you know what you can do now. So what you can do now is this and that, and I'll give them their instructions what they can do now.
Yeah, help them feel better about that.
But we're not calling to blame and shame them.
That's a good that's a good point that you make. Blame and shame is what I try to do on social media. I'm just kidding. And the other thing that I thought was funny is you're like, well, if they're crying like you, and I wanted to say, Rain, I do cry a lot more. I'm an adult male and I'm in touch with my emotions. So I just want to put that out there for everybody. I've matured a lot in the last 20 years.
It's all right.
Um, Tell me, so one question I have for you, what is contact tracing? What does your day look like? Like you work however many hours. I assume you're doing this at home and you like probably have a list of people that are positive and you're calling them on the phone and then you're having a phone conversation that's like, "Okay, buddy, Bill, your COVID's
Mm-hmm.
positive. We need you to obviously stay home." And where is like do you is it where have they all gone since they've been obviously since they've had symptoms, but then how far back do you go? Like, are you trying to figure out where they've gone last week? Like, this can get blown out of proportion. This can get really hairy fast. What exactly is it that you do when you call them? What is contact tracing? Some of the nitty gritty.
Okay. So yes, you're getting every place that is testing, whether it is a small pharmacy, a chain pharmacy, a doctor's office, is reporting. COVID is a reportable disease, and they're reporting to their health department. There's other reportable diseases. So, for instance, do you think TB is?
Absolutely, TB is a reportable disease. Because I would say of all of the stuff like flu, no, we don't do this with flu, but with TB, public health gets involved. And
Right,
contact tracing now, I think people are way more familiar with it in
right.
COVID because of the implications. But the reason there's not a lot of TB in the US, this is one of the reasons, is because they're aggressive. They've put people in jail over TB before in
Oh,
the
okay,
past,
right. Yeah, and we're
over quarantining them because they don't want them. And TB is not nearly as communicable as something like COVID.
right, right. So, and that would be a nightmare because that has a much longer incubation period. If I understand correctly, like you could be exposed and it could be much longer before you have it.
It's much more slower growing. It takes more of an exposure to get it. We typically think about it in homeless shelters and jails with kind of that at-risk population that are living in close proximity to other people where bunk beds and they're breathing,
Right,
close same air for hours. It's not like you
right,
get it in passing kind of thing.
right.
But anyway,
But
back to the nitty-gritty
I
of what
think
you're
it's
doing.
important though because we haven't eradicated TB, but we keep it down so that as long as children get their vaccines for school and new people come into the country, well, but we keep TB under control with contact tracing and with health departments because sometimes people will act shocked and offended that the health department is getting involved, but the point is COVID is a highly contagious disease and it's a reportable disease, so that's why we're getting involved. So for my day in my health department, each morning I'll receive the names of people who've come through and I don't know where they've tested, and I've got to start calling them. And one of the questions will be, how do you think you picked up the virus? That is one thing I'm trying to find out, and it can be very hard to find out. The other question,
And what percent of people know? I mean, when I've been in the ER and we've got a positive,
mhm,
I would say less than half have a. Most people don't know where they got it. Some people are like, somebody I live with is positive. Now I've
yeah,
got symptoms, and that's like, okay, you've got it. That's where it came from. Some people, it's like maybes. Well, I work, at the grocery store. I work at whatever. That's
right.
probably where it came from, but they don't have a discrete person. But I would say most people that I come, the positives that I've seen, they don't know where they got COVID, whether it's an asymptomatic person or somebody who got symptoms later, or just somebody they didn't know who could have had symptoms, but they didn't even know. But most people don't know where they got it. Is that your experience? What's your experience?
I think it's about 50-50, but it's because
Yeah.
there's still too much community spread, and that's really why we want to have lower cases per 100,000 and a lower positivity rate because we don't want people to be picking it up randomly. Once I had a call with a guy in his 30s. He was a dad, and he had absolutely no symptoms. So I said, "Well, how do you think? Well, why did you get tested if you had no symptoms?" And he said, "Well, my son spiked a really high fever, and we had to bring him to the hospital, and it turned out he had COVID." And then I
Mm,
looked up the name, and I was like, "Is your son a baby?" And he was a little 0-year-old baby, and he had
wow.
COVID and dad was asymptomatic. And it's like you don't want to be able to just pick it up like that and not know. So same thing
Well,
for,
I'll even challenge what you just suggested there, which was
okay,
that he got it from the baby. Maybe he gave it to the baby,
yes, which
right?
he
It
could
could
have
have
gotten
been
it
the
at
other way,
birth.
right?
Yes,
Where the baby get
absolutely.
it, probably from one of the two parents.
Right, right. And so are we saying, like, as a society, people who have any at-risk person at all, they can't work, they can't go anywhere, like the elderly need to stay locked up for the rest of their lives? Is that really what we want to say? Or do we kind of want to try to make the conditions safer so that it's not so easy to pick up? That's that's
What do
what
you think? What do you think about that? What's your answer?
well, I think we need to make the conditions safer. I think that there should be some quality of life and enjoyment, even if you live with someone who is high risk. And
Hmm.
that's why people are exhausted, because a lot of people have had, a very dull, long, isolated year, and sometimes they still get it anyways, sadly.
Hmm. Hmm.
But back to your
Even though
point.
they're doing all these things that,
Yeah.
yeah, boy, we could get into that one. Let me just say this really quick.
Hmm.
I'm not a big fan of quarantine lockdown, like lockdown everything, keep everybody at home. I think
Right.
there's so many better, more creative ways that we could be going about this pandemic. I'll give you one example. A buddy of
Sure.
mine in Australia, again, I have a lot of these examples from other countries that do it differently. God forbid the United States of America learn from Japan, who has like the lowest rates in the world, or even China, who's reopened it so many. Don't get me started on all of that. But there was my buddy when Australia was more open. They're not more open right now. They're incredibly
Okay.
locked down. And you went to a restaurant, they were still open at this period. Everybody had to give their phone number. Everybody that went
Oh,
to the restaurant, if you didn't give it, you couldn't go in. And so each day, if there was a case, they would just hand that over to their contact tracers, and they were that active to where
wow.
it wasn't just somebody, and I assume this is what you're going to tell us, but when you talk to people, it's just what they can remember. Well, where did you go? Oh, I went to the grocery store the other day. Well, you can't track down everybody that walked through the grocery store. They don't know who they passed. Or even if, let's say that you could do some dining and go to a restaurant, how would you know who went to that restaurant? We don't have that kind of a system. Correct
Right.
me if I'm wrong. We don't do that to that level in this country, which is unfortunate because you give them your phone number. That you go to this restaurant,
Hmm.
you're able to go to the restaurant. I think it's a way that we could have opened things up more and done it safely. And then
Right.
if somebody does have it and they sat at table 4 and you were at table 5, then you need to pay attention to it and we could track
Right. Yeah.
that. We're not doing that. Why aren't we doing that? Going to my Tom Cruise crazy again. Why aren't we doing that? Like, so there are
Right.
things, and that's not super expensive. That's not, like, there are things we could and could. So I am not necessarily an advocate of close all of California down because
Right.
LA is on
Right.
fire. But then on the other hand, people still are dying. It's very
Yeah.
serious, and a lot of them are the weak and the poor and the whatever and need to be protected. So there's this balance in there, and I don't think we're executing these values
Right.
and these priorities right. Okay, that said,
Yeah.
yeah, any comments
And
on that?
we can add, some of the people getting seriously sick are people that we would never expect. It is still a new virus, and that's always sad to see too. When you know, I can see ages on my list, and so I call somebody who's 41, 42, and I think, okay, this will be an easy call. And when they answer from the hospital, out of breath, it's very jarring. And I will say, okay, I'm going to call you back later, and you just cross your fingers and hope about that. So I didn't. Sorry, I completely got off track. But what you go over with the person is how they think they got infected, and then you kind of pinpoint everything they were doing up until the time they learn from their infectious period until the time they got their test results or isolated. So infectious period for most people is going to be 2 days before they started to have symptoms. And if they have no symptoms, then we just go 2 days before their test dates. So it's usually about 4 or 5 days. And I've gotten a little better than when I first started. So now I just go with them day by day. Okay, what did you do Sunday? What did you do Monday? And and if they say,
Yeah.
well, I went to work, I say, okay, do you have any friends at work that, did you eat lunch with your friends? Did you spend time with anybody that would have added up to 15 minutes? And can I reach out to them? And so um, by the end, I'll give them their instructions for isolation. And now I've got names and phone numbers. So some of the contact tracers call them right away, but actually I save those to the end of the day because like it makes the last hour go by really quickly because those are calling the people who've been exposed is actually a little bit easier call and more gratifying because you feel like, okay, now I'm helping. Even when it's people who are living with someone in their own house, like they
Mm-hmm.
feel they feel like cared for because now you've called them and told them what they need to do. And they have questions like, well, is it too soon to test? Or do I really have to quarantine for 14 days? So that's kind of how I do it for my day.
Mm-hmm. So on let's say the average person, how long is that conversation? I imagine some of those can get really, really long if they've been running around with symptoms for a week. Then you're like, oh my gosh, what did you do here? So I'm
Mm-hmm.
curious, like, how long is the conversation, and like, what's the average list of people and phone numbers that you come out of that with? Like,
Right,
is it like 10-minute conversation, five more people that you're going to call from this
right,
infected positive COVID person?
right. I'm as hard as I try, I mostly get household contacts. It's very hard to get friends or, I mean,
Yeah.
sometimes. So that's the bad news. I tend to have conversations around 24 minutes. Like one day I noticed they were all 24, sometimes shorter. My managers, my managers might want me to be a little quicker, but this is an example of why it can work. Once I had a conversation with someone for 52 minutes and their
Wow.
whole family had been out and about doing things, and I just appreciated this person so much. They lived in my state in a part where a lot was open, so kids were in indoor sports. They were going to school in a carpool.
Yeah.
And she went through every single person's infectious period and told me, and I was like, I don't begrudge her in the slightest everything that they were doing, because first of all, the epidemiologists are the one who decided like this is open, indoor children's basketball is open. So she didn't, and secondly, because she cooperated so much, like that's all we ask. If you want
Yeah.
to have that freedom during the pandemic to participate and be doing a lot, if it happens to you, if you could just help by allowing us to know who we should quarantine, who we should call. So
Yeah.
that was a really cool lady.
What? So, um, 24 minutes on average, and then it doesn't sound like you get very. Here I am thinking, God, you're gonna have lists of 30 and 40 people to call and track down that have been exposed. But you're saying you don't really get very many like that. It's just like, here's who I live with. That's a little
Right.
surprising.
There are some who do though because we have some teams to handle like the special ops, special operations. So
Special ops
yes,
contact tracing. Are you eligible for that yet? Do you go through
no, I'm not. I
special
think
ops training?
I'm not. I'm not fast enough. I'm talking to the criers. So, but
Like
you
me,
know
the
what?
criers like me.
Yes, like you. Once I did get so communicable diseases is working with contact tracers. Communicable diseases have been doing this much longer,
This
right?
is another Department of Public Health. What is communicable
Yes,
diseases?
yes.
Your
Most
contact tracing? This is like a
most
division or something?
yeah, most public health departments have their communicable diseases who have the experts. So when they get a call from, let's say, a hair cutting place, okay,
Okay.
we they get a
Like a
call.
bigger level exposure or a super spreader event or something. Those are the bigger guys that, okay.
And then they give the list. Or, it's actually working really well in schools and colleges because they're providing the lists. They want to stay in operation. They don't want to have so many people quarantined and so many teachers out that they can't even teach classes. So they will give the lists, and then the special ops will get the name of the person who tested positive and then like their 30 close contacts that they need to
Mm,
reach out to.
yeah,
And they
wow.
might even first they'll interview the person who tested positive. There might be some more in their personal life that their school or whatever didn't know about. So
Reen, where do you live? What part of the country are you in?
I live in Illinois, outside of Chicago, suburbs.
Okay, suburbs of Illinois. And when you get a list, is that for like your county that you're in, or is it all the state of Illinois? Or
It's being done by county in Illinois.
okay, so you get your list in the county.
Yeah.
And it sounds like you're saying the schools in your county are open. People are having class in school, some
Some
places.
smaller, more rural school districts have been. My own
Yeah.
kids haven't. And that's when it was hardest for me not to yell at people was in the summer when I still had the hopes that my own kids would get to go back to school because it's like, oh, why are you having a baby shower? Couldn't that wait? Or, a housewarming party? Is that essential? But like I said, I've learned not to try not to get the person to hang up on me. Try to give, the most impact that I can.
I think that's smart of you. I'm sure all of us have just these moments of anger and resentment at the way that some, especially when you're following the rules and when many are not. When you're doing contact tracing and people are kind of telling you where they are getting it from, what are some of the most common things that you have seen in terms of where people have gotten COVID?
By far, it seems to be private gatherings of family and friends, especially like Eid,
Really?
the holidays.
Like Thanksgiving and Christmas and New Year's?
Yeah. And
Groups of 5 or 6 or 10? Is there a number? Because I know for a while people were saying no bigger than 10, no bigger than 6, as if 5 is okay.
right, no, it doesn't matter the number, it just matters if they were in different households. And I think some of it could be
Interesting.
avoided, maybe if there was more messaging that wear a mask also could apply to your private gathering. I
That
don't
I don't,
know.
if it's like if you're gonna get together, you're gonna eat and drink. I would
Yeah,
say you just don't get together. I don't know if that's practical for most.
right, right,
Interesting. Okay, so private gatherings like holiday stuff.
right.
I'll tell you what we saw in the ER special and in the hospital,
Yeah,
especially
what do you see in the ER?
when I was in Southern California in Compton, numbers weren't so bad in November, and then literally right after Thanksgiving at the beginning of December,
Mm,
and predictably like 2 weeks later, deaths, like it was totally post Thanksgiving. Like it lined up. You like take a step back and you look at months. It was kind of like nothing in the summer, and then it went up, and then it went down. It was kind of smoldering, and then it was like Thanksgiving, and it was like, and it's just gone like this. Thanksgiving,
mm.
Christmas, New Year's, and it's been like, it's like facepalm. That's where it came from. Um,
It must be so exhausting for healthcare workers. And healthcare workers get it too, so
yeah, got my second vaccine today. Thank God. There's, I think, especially for ER workers, I think, first of all, God bless nurses. They've done an amazing job in this. Holy cow. I don't say it enough. I think it's even harder in the ICU. I worry about my ICU colleagues because more people are dying. They have maybe 10 or 20% of their patients die to begin with, and I think it's more with COVID. So that's really hard. That said, ER is often, we're very accustomed to stress and crazy.
oh,
10-hour shift, 12-hour shift, 24-hour shift, 7-hour shift, whatever it is. A lot of times when you're there, you're going to be busy. It's going to be stressful. You're going to do it, and then you step out of it. So there is a normalcy to some of that, even though it is in the middle of a pandemic. When I was in Compton, I literally admitted several patients from this MASH, this mobile surgical hospital, this tent in the parking
oh
lot outside of
gosh.
the ER, where there's no beds, they're just sitting in chairs and they have a little oxygen on them. They're not critically ill, these
Mm-hmm.
ones, but their oxygen was low enough to where they needed to be admitted. In this particular hospital, which is largely serving Black and Mexican, Latin American community, these guys were all Mexican. A lot of them were young men still working. A lot of it was families. It was like family spread and work. Uh,
Yeah.
um, it's a complicated thing. I don't think the public health message reaches them. It's not in their language, even if it's in Spanish. There's no benefits to them. There's no unemployment, so they keep working to survive. And I think they're rascals too. I think there is a American cowboy that's a little Mexican cowboy that, just like all
Oh,
of the kind of Trumpy whatever's resisted, I think they resisted too, and so it's a combination of all of these factors, and it's bad. It's really really bad in LA.
Yeah, I mean, there's definitely, I'm gonna muscle through. I just have the sniffles. So it's completely different. With COVID, to tell people the slightest sign you have that you might be sick, no, don't muscle through. Don't try to just, keep scraping by at work. You need to go get tested. So, I,
Yeah, I think one of the take home messages is if you get a little bit sick, start to isolate yourself, really double down on the mask and the hand washing and keeping a distance from people because I don't think anybody wants to give it to anybody else. So
right,
whatever you're doing, wherever you're doing whatever, like truly do your part to not give it to anybody who wants to be a part of that. That's awful.
right,
That's badness. It's
right,
crazy. This thing is truly an invisible disease. We can't see it. It
right.
makes it hard to believe sometimes.
One thing I've noticed is that one place where it could be better. Okay, so if you're going to gather with people, maybe wear masks. Maybe that's not going to make much of a difference. Because, I mean, to be honest, I would still have to contact trace that 6-person New Year's Eve party, even if they tried to wear masks most of the time, because we're so imperfect at our masks. We're fussing with them, we're touching other things as the people that we're with. So the mask does not give you like immunity from being called close contact. So if somebody who is at your
Especially in an indoor
right,
gathering, a long period of time. Once you
right,
add food and drink, I'm like, forget it. You
right.
know.
But this is one
Um,
thing I wish people knew. If someone in
yeah,
your house tests positive, okay, now not all households can do this because there may be little kids but if I see a lot of households with like all adults, like 19-year-old sister, 23-year-old brother, mom, dad. Let's say mom tests positive. Everyone else just assumes they're fine while mom goes into isolation, and hopefully if they know the requirements, they stop working and they're just, hanging out. No, no, no. Those other three, dad, brother, and sister, should not be hanging out together. They've all been exposed and they need to quarantine apart if possible.
oh,
Because what
that's right.
happens
Everybody
so
needs to
much,
stay separate.
what happens is then the sister gets it 2 days later. Well, now dad and brother have been re-exposed. And then the brother gets it. Now dad, and then eventually you see
Oh,
it both. You can see like the household. It goes like every 2 days someone else tests positive. So it
interesting.
didn't prevent it at all.
I think it's interesting that I would have thought one person has it, they bring it home, everybody gets it. But it's really interesting that it isn't that contagious, that there can be a delay in the same household of a couple days, between it, which really kind of brings home your point of individual separation at home to prevent the spread of that thing.
Right. But not
One
everyone
another
can do that. You need like enough house, enough rooms, or you need to be able to have, cleaning the
Yeah.
bathroom or 2 bathrooms. So not everyone can.
Let me ask you a couple of questions. So you're in outside of Chicago. Have you seen increased cases? Are your guys, workloads going up in the last couple months? What are the numbers like there?
And I'm sorry, I didn't know my room was going to become like dark as a tomb. So
No,
this is
it's great. We can still see
okay.
you. Keep going. Yeah,
Okay.
no, it's working.
Actually, we saw our biggest surge in right after Halloween in November, and for some reason I can't explain. We're doing okay right now, but also my particular health department more than doubled the number of contact tracers. So
Good. That is
maybe that's
sensible.
part of it. So, but during the surge, it was very discouraging because every day I would start with 30 or 40 names, and they they were there was no time to call the close contacts. You were just calling the people who tested positive, and you were kind of like giving them the message. And I started a really good practice then. I always get an
Mm,
email address when I'm on the phone with someone now, and I always email them
mm-hmm,
instructions for their close contacts. I still do that now because we have a way to communicate. And
mm-hmm.
but that just felt so sad. And there's a lot of people that I never was able to call at all because each day you have to start with your newest names. You have to try to go for those newest people first. So it was it it it's not stressful the way an emergency room would be stressful or having sick patients in front of you, but you still feel it still takes a little bit of an emotional toll.
Yeah, absolutely. Stress is stress. The body still feels it in a very similar way, even though the situation is different. Um, what do you, it's interesting to hear that when you, it's, what do you do when you don't have time? Like, what do? We go faster. Sometimes certain people don't get seen. There's triage where the less sick people wait longer. That's probably the main consequence in the ER. People wait longer wait times. And of course, the longer they wait, some people get sicker and worse. So it's interesting to hear, like, when you guys get busy, what do you do? Well, sometimes you can't trace all of them. It's a conversation with the person there. You talked about feeling discouraged at some of the outcomes and some of kind of the bigger picture things. What do you say to that? How do you get through that? I think a lot of people right now, not only in healthcare and on the front line or even doing tracing IQ, even people at home are discouraged. How do you deal with that?
I think it, yeah, it's been a long month, number of months. How many months has it been now? It's been since March or even
God, I
earlier for
don't,
people who are in healthcare.
Marina,
So,
I don't even know what day it is today. Forget how many months we've had a pandemic.
yeah.
I think it's the Windsors Day today. That's the that's the
Yeah,
day.
I know I think we can all relate, to just being, so, wistful for the lives we used to have, the things we used to do, being able to have relief from our, day in and day out. I think we all can relate to that. So, I think though our society has also come a long way, even though at times it may feel like the contact tracing isn't working and the vaccines are going out too slow. You know, I have certain calls with people that really gives me hope, and I know I have a friend who is like keeping a list of where she goes each day and who she sees. Like she keeps a spreadsheet so that if she's ever called by a contact tracer, she can be completely
She's a
accurate.
dream client.
Yes.
So where have you been? Let me send you my Excel spreadsheet. And you're just like,
Right.
oh my God, you're a dream.
Right. And
Complete with cell phones of everybody she's come in contact with.
yeah, and some people, they really want to do their best that they can to, let us know who might have been impacted. So I think that we've come a long way. Public health is a very new concept to Americans. We don't think like we have private health insurance, what's public health? And we've been learning all these months, like, okay, the health of everyone in the community, even the people in long-term care facilities, even the people in prisons, matters for all of us. And it's not fair to have this virus running rampant to the healthcare professionals who are also like, it's not like your ER was empty before, right? you know
Exactly. It's
there's
great. Totally.
it's not fair to cancer patients, it's not fair to people who work in nursing homes. So I think we've come a
Reen,
long way.
give me a couple examples of the conversations that you've had with people that give you hope.
Well, there was someone once who called in because they thought their quarantine might be done. And when I looked them up, I saw that they had like 2 more days. They wanted to go back to work. And I'm like, oh, I'm sorry, you have to go, these 2 more days, and then you'll be out of quarantine the day after your 14th day. And they said, oh, I thought they would be mad, but they said, well, I want to do my best. I'll do whatever it takes. I don't want to spread this virus. And so that turned out to be a really pleasant conversation. And it gives me hope too, just to see, what people are like. People are so hardworking. Once I had a couple, they had blue collar jobs, and they both were positive, and they had the similar isolation period, and they wanted to work as soon as possible. As soon as their isolation was done, they wanted to
Hmm.
get back out there. They started
Yeah.
their shift at 4 a.m. in the morning. But the problem is the texts that we send to tell people, we send them a text each day to check in, and then we send them a text when they're all done with their isolation or quarantine to say that they're done, and it gives them an email if they need it to show their employer. Well, the texts don't come until 7 a.m. So we agreed though I could send it manually. So I'm a night owl, so I just stayed up a little bit later until midnight, like 12:01, to send them their letter manually. And it's just, just think about that. They wanted to get back to work so much at 4 a.m. the day after their isolation was done. So I think it just shows me the good of people. Awesome.
There's definitely throughout the pandemic, you can see examples of humanity that is tragic and just disappointing, and examples of, unfortunately, the evil that we're capable of as human beings. But there's so many examples too of good people doing good things and doing the right thing. And unfortunately,
Talk
the
about the
world,
bad ones now.
the media world is what it is, and a lot of times the negativity um, gets more clicks and views and ratings, and that's what drives too much of it, which is, I don't like that part of the world. That said, yes, give me some of the dirt.
Well,
There is good stuff out there, but let's hear
yeah.
some dirt now, because I
Right.
want ratings too, damn it.
I had well, this far into the pandemic, you would think people are expecting some sort of call or something. So, it's off to a bad start. When you begin, you want to verify their birth date and their address just to make sure you don't give health results to the wrong person. I have
Right.
called before where I was talking to parents in their 60s with adult son and a girlfriend, but the son and girlfriend never told them they were positive. So you don't want to get in the middle of that. You have to make sure you have the right person. But when you first start with birthday, how did you get my birthday? Who told you you could have and it's like, I'm not going to give it to you. And it's like, well, you're not giving it to me. I have it already in front of me. You're just verifying it. So what is this about? Well, I said I was calling from the health department. Like, can you think of any reason why the health department might be calling you? But it's probably not good to get too sarcastic because that doesn't help the conversation go in the right direction. But
Yeah.
I had somebody even
No.
as recently as this week say, what is this about? Well, I'm not telling you anything.
All
The,
defensive and threatened by your call.
yes, the
Yeah.
worst week was actually, I can tell you, and this shows that leadership matters. No matter what you thought about Trump, if you were a fan or if not, the worst week ever was the week that Trump got sick, went to the hospital, and then got well again. It all happened
Yeah.
how many days was that? Was it
He
like,
went into Walter Reed on a Thursday and went out back to the White House on Sunday. So he was only in for a few days.
yeah, so here's what I think happened there. People who were listening to him say, it's nothing worse than the common cold. It's nothing to be worried about. If they had it that
Yeah.
week, it was like they're wrong. It was like personally embarrassing. People who maybe didn't like him still, he kind of
Mm,
spoke to that little voice in your head, like,
mm,
so because it's the president. You just saw him, you
mm,
know, he was fine again. So how can it really be that bad? So that week, I had more hang-ups, more people who never answered their phone, more people who were angry. Someone who told me
oh, when he was sick or after? Or
just
both?
during the whole like
During that
series of
whole
days.
thing.
Yeah,
Interesting.
people telling me, I don't really think COVID is a thing, and someone told me I got a negative test and a positive test the same day, and I'm going with the negative, because Trump, he
Not how it
passed out.
works.
Yeah, he passed out on the testing, and so it was
Do you
leadership
have a
matters.
It does.
Yeah.
That's a good way to frame that. Do you talk to a lot of people that flat out don't believe in COVID? Or are there some people that are like, it doesn't exist? That positive test, it's not real. I'm not going to do anything.
The hardest conversation, well, not the hardest conversations, but it is a little difficult for people who have no symptoms
Yeah.
because it's just so weird. How can I have no symptoms and other people are sick enough to go to the hospital? So, but they're mostly will go along with it. I say even though you're not coughing or sneezing and spreading the virus, It still is mostly getting around by your respiratory droplets. So we'd like you to wear, if you can, wear a mask in the house, stay isolated as much as possible. So the other thing I
Yeah.
hear a lot is people will say, this wasn't as, I've had colds worse than this. This wasn't bad at all. I
Yeah.
barely, I barely blew my nose twice. But that is not really the point. The point isn't that you got through it fine. The point is we can't keep having it spreading, because for you it was a cold, but for someone else, it means the hospital. It means not working for 24 days because you and your kids got it. Or it can mean,
Yeah.
emotional distress. So it really, the fact that you had very few symptoms in a mild case, that's great. But that's not really the point. That's not the reason why we have to stop the spread of COVID. That's what I think.
God, I I I want to kind of validate and empathize with people how this can be very difficult to understand this new virus and this invisible. It's still crazy to me. You couldn't have convinced people 500 years ago that that was such a thing as it would have been easier to convince them that they had some evil spirit and that the treatment was an exorcism, not
Right.
isolation or remdesivir or dexamethasone, some steroid. So I can empathize with that. It's
Yeah.
hard to understand. Um,
Yeah.
it's
It is.
hard to understand, especially when you don't have symptoms, you're not sick, you don't get it. I'll even observe in myself the media doesn't help. The collective media, which includes so much garbage and conspiracy theories and just complete nonsense. The really crazy
And you've
thing
done a
is
good job trying to, it's like whack-a-mole sometimes, trying to
it's
pound
exhausting. I'm
down.
so sick of it. I'm so sick of
You've
it.
done a good job.
Um, the crazy thing is what happens to me. I've pronounced multiple people dead from COVID. Like I have resuscitated people. I've diagnosed countless, admitted countless to the ICU, to the hospital, and sent people home that are fine. And when I'm away from work for a week, I start to like question it a little bit.
Okay.
Like my own
Yeah.
mentality starts to hear these little whatever these voices are. It all comes from garbage media that whether it's the extreme right person that I is in a friend of mine or family or whatever, and and
Yeah.
and I like have I think those that work in healthcare, especially on the front line in hospitals, have um, the privilege to witness this in a very real way that it isn't real to so many people, and it
Yeah.
boggles my mind that even grounded in that, it's like every time I go back to work, I get reintroduced to the reality of this and how it impacts people and how so many people die and how it is real and serious.
Mhm.
That context, and it's so that's crazy.
Yeah.
And that's part of our challenge. It doesn't change the reality, which is, I don't know, is it 400,000 Americans have died? I don't even know what the number's at now. Too many people have died. Too many
Yeah.
people have gotten sick. And too many people are also suffering all the mental health and the problems of the economy, all this stuff, because it was all, we could have done so much better in this. But the
Right.
virus is where it all came from. But
Right. Yeah.
that part boggles my mind that it can have that effect on me, and it does. So I can certainly understand how somebody who's a
True.
farmer out in the middle of nowhere and happened to pick
Right.
something up when they went to the market is like, what are you talking about? Like this does
Right.
not exist, this invisible virus thing. And it's like, actually it does. And it's so very real, even though for I can understand how for so many it can be really difficult to grasp it because you can't
Yeah.
touch it and see it. And like I, I haven't seen the consequences of it, and that's the
Right.
realest thing that there is. But
Yeah, that is
getting all
really
philosophical on you,
interesting.
Reen.
No, no, I think we love philosophy. Um, your philosophy minor. Are you not?
Second major I was pre-med, which we called pre-professional at Notre Dame, as you remember.
Okay, I dropped out of that.
Philosophy second major. I remember I think you and I were in engineering calculus. I don't know what was his name? Wong or something?
Oh yes, my worst
Engineering
grade.
calculus.
My worst grade. Yeah.
Pre-professional. I did decent in calculus. Pre-professional,
You did.
second major in philosophy, and a minor in theology. I love that stuff.
Yes.
Both of those were good at Notre Dame. You went to read some books, if I remember.
Yes. So once I had those horrible grades freshman year in pre med, I went over to the great books, which was called Program of Liberal Studies. But I also got my
Mm,
theology too.
hmm I
But
wish
yeah,
I would have read more books in my life.
I still can.
I should have. Books are great. You should read.
But I think that just speaks to the mental break that everyone, especially frontline workers, needs. Where I think a lot of people have been able to spend the last few months trying to go about their lives and not think about COVID, and they've done it very bravely too. Like, okay, this is how we're going to do school now. This is how we're going to work in our offices now. They have thought about it a lot and tried to make their conditions as safe as possible, but um, those who haven't had that opportunity since February or March need the break. So
No kidding.
it must be why you notice that when you go back to work on Mondays.
I've even more and more, especially as it gets worse in California, I listen less to the media. And I'm doing especially with all of the recent, political stuff. I voted, I've participated in the government. I don't need the play by play every week, every day, every hour of what's going on. It makes me crazy. I need time off, you know.
Yeah.
Reen, this has been really good. Thank you for doing this. I want to give you the opportunity to, if you have any concluding thoughts or anything else you wanted to say that we didn't get. But this has been interesting for me to hear, your perspective. I'm so glad that when you felt so powerless in the middle of the pandemic, you did something about it. This is the thing. This is the thing that I think is true for all of us. So true for what you do and for people who give vaccines and who had a part in making the vaccines. But your work has saved lives without a doubt. And the crazy thing is, those people that are alive, they'll never know it. They'll never know that because of what you did, they're still alive and able to enjoy their life and have more time. And that's just a really, really cool thing to be a part of. So thanks for doing what you've done. And it's such meaningful work. I wish we did more and did it better. And we're going to get through that thing. So thank you for doing this.
Thank you.
Do you have any
Too much
closing
credit.
thoughts for us?
Well, I might have said my closing thoughts already, but I really think that, once people understand the purpose of contact tracing is not to, not to make you feel guilty about what you've done or, anything that's happened, but just to really try to figure out who should quarantine and who needs to stay safe if they need any help staying safe. I think people will feel less suspicious and unnerved by contact tracing. And already I've seen such a change since July when I started. Our society's really come a long way already. We understand so much more that what we do affects others, and we realized that during the pandemic, some things are going to be put on hold. They're going to look different. School's going to be twice a week instead of every day, or whatever it takes. But I think it's overall, I feel like people have shown how good we are and how much we care about each other. That's my final thought.
I'm happy to hear that, seeing it from what you've seen, that you remain an optimist. I'm glad that we didn't have this conversation. You're like, there's no hope for humanity. We're screwed. The pandemic's going to take us down. I know, because I've called people. Rain, do you want people to follow you on social media? Is there somewhere they can go? Do you have any? I always give people that opportunity.
Oh, sure. Yeah. I have
What?
I have my Instagram, greenmargaret7997. So they can come and follow me there. It's not
Maybe
that
ask you a
exciting.
question or two about
Oh yeah,
contact
I'd love to
tracing or
talk about it.
exposures and stuff.
I should thank you because you just gave a nice hour-long break to all my family members and friends who have to hear me talk about it nonstop because it's really been like a passion and there's just so much to process every day. So thank you from my family and friends.
That's my pleasure. You know, a deranged sister of yours needs to hear this kind of stuff. She hasn't heard it enough. That's Kate Mulligan. I don't know what her new name is, married with whatever, but you need to contact Tracer every single day for that's what I think. So I'll
Kate
go on the
Mulligan, and
record.
again, they can follow her. No, Kate's mom ever. They should follow her.
Yeah, I'll go on the record as saying that. Well, we need to end. Thank you
Okay,
again,
thank you. Thanks, Larry.
Rene. I'm going to stop the
Nice to
recording in a
see you
second.
after 19 years.
Yeah, hang on just a second. I'm just going to stop the recording, but we can talk for another second.
Oh, okay.
Thank you for everybody that watched this. You can reach out to Rene. She gave her Instagram. What is your Instagram again? They had a bunch of numbers.
Green Margaret 7997.
Rene Margaret 7997. 7997. I know what those both mean.
Don't ask why.
It took me a second, but now I know what it is. Thank you, everybody, for watching this. You can always reach out to me on social media, Dr. Larry Burchett. Let me know what you thought about this, especially if you got this far and you watched the whole end. Reach out and tell me so. If you had any questions, comments, or whatever, there's other people that you would like me to interview. I'm always happy to do it. This has been a good one. Thank you, Rene. I'm pushing stop now. You can watch. You can always find this stuff. There was a preview on Instagram Live. That'll be on my Instagram. But then these things live on the podcast, which is on Spotify and Apple Podcasts, and this video live is on YouTube. Thank you for watching. Take care of yourself. Stay safe. Do vaccine is going to end this thing. Bye.